Today, we will be discussing Alzheimer's disease, which affects millions of people worldwide. Alzheimer's disease is a progressive brain disorder that slowly destroys memory and thinking skills and ultimately, the ability to carry out the simplest tasks. Alzheimer's disease is a neurodegenerative disorder that affects the brain cells and connections, causing them to die. The disease is named after Alois Alzheimer, a German psychiatrist who discovered it in 1906. It is the most common cause of dementia in older adults, accounting for 60 to 80% of all dementia cases. The exact cause of Alzheimer's disease is not fully understood, but it is believed to be caused by a combination of genetic, lifestyle, and environmental factors. The disease is characterized by the buildup of two abnormal proteins in the brain, amyloid beta and tau. These proteins form plaques and tangles that interfere with the normal functioning of brain cells, causing them to die. The symptoms of Alzheimer's disease can vary from person to person, but they typically progress slowly over time. The early symptoms of Alzheimer's disease include difficulty remembering recent events or conversations, misplacing items, and having trouble with basic tasks such as cooking or managing finances. As the disease progresses, individuals may experience confusion, mood swings, and changes in personality. They may also have trouble speaking, reading, or writing. Diagnosing Alzheimer's disease is not an easy task, as the symptoms can mimic those of other diseases. However, a proper diagnosis is important so that treatment can begin as soon as possible. Doctors will typically perform a series of tests to evaluate memory and cognitive function. These may include blood tests, brain imaging tests such as an MRI or CT scan, and neuropsychological tests. While there is no cure for Alzheimer's disease, there are treatments available that can help manage the symptoms and improve the quality of life for individuals with the disease. These may include medications that can slow the progression of the disease and improve cognitive function. There are also non-pharmacological interventions such as cognitive stimulation therapy, physical exercise, and social engagement that have been shown to be beneficial. While there is no surefire way to prevent Alzheimer's disease, there are several lifestyle changes that individuals can make to reduce their risk of developing the disease. These may include eating a healthy diet, engaging in regular physical exercise, and keeping the brain active through activities such as reading, learning a new skill, or doing puzzles. It is also important to manage chronic health conditions such as high blood pressure, diabetes, and obesity, as these can increase the risk of developing Alzheimer's disease. By making lifestyle changes and managing chronic health conditions, we can reduce our risk of developing Alzheimer's disease and improve our overall health and well-being.